So we are what we call in France a competitiveness cluster, which is cluster dedicated to technology transfer between public labs and private companies. So we are working on collaborative projects in 6 different major technologies and 5 application sectors. So the technologies we are working on are cybersecurity, which is our first area of expertise, because we were created in 2005 around cybersecurity in the banking sector. We also work on data and artificial intelligence, immersive and interactive content, hardware and software, photonics, and networks and infrastructures, such as 5G, which is coming very soon, and we are already working on testing projects for that. And regarding the application sectors we are working on, we not only work on digital health, as you can see, but this is our major application sector, with the one where we have the most members and the most projects that we are supporting. So I'm going very fast. We have a bit more members than that at the moment. I think we are 160 members. We are also 10 people working at Pôle TES today. And our members are composed of big corporations such as Orange, insurance companies, etc. We also have small companies. We have associations. We have public authorities. So really, we also have hospitals and healthcare centers. So we have all types of members working with us. Our 3 main application sectors in the digital health area are biotechs, e-health, what we call e-health. So it's basically IoT, data, artificial intelligence, etc., applied to the health sector to help making decisions, etc., and silver autonomy. But we are also developing in other areas since the beginning of this year. We are focusing, for example, on mental health. We've had an event last month where, or 2 months ago, I think, where H Alliance actually participated. And we are also developing in the sports area. One of the idea of our work in digital health is that we think that Normandy is an ideal testing ground, because we have rural areas and areas where there is no doctor, no access to healthcare, but we also have big cities. We have our regional hospital, which is being rebuilt at the moment. So we are working with them in order to plan the inclusion of innovative technologies. So I'm sure we'll be less less innovative than the hospital of the future in Ely, but we are trying to get there. And we are also working with our partners in Normandy, in Brittany, sorry, and Loire-Atlantique, so Rennes and Nantes. Because they also have university hospitals that are being rebuilt, and we are working with them as well on how to include digital technologies in their building. I'll go very quick on that. So as for the other clusters that have been presented, Hub Brussels, we are basically the same service offer. So we are supporting projects from the idea up to the market. We are also very involved in European projects as well, in Interreg projects or Horizon Europe. And we are of course organizing events regularly. And on the 30th of May, as Andy has said before, we are welcoming the event that H Alliance is organizing for the French ecosystems. And just very quickly, I wanted to make a focus on the Nuno Santé, which is a project we have been started working on since this January. I think that most of you are probably familiar with the Digital Innovation Hubs initiative that has been launched by the European Commission. So we are the leader of the regional digital innovation hub in Normandy, which is not dedicated to the health sector. It's dedicated to connected mobility. But we have decided to apply all the methodology and organization that we planned for the DIH also to the health sector. And we are trying to build a kind of virtual third place for digital health in Normandy. So the idea is to support companies and startups from Normandy, but also from the whole of France and other countries in Europe to test their solutions in real conditions with partner hospitals and partner healthcare facilities. The work topics that we are working on with these projects are the aging of the population and how they can stay longer at home in better conditions, etc. Mental illnesses and sports. And the idea is to structure the healthcare organizations in Normandy around the idea of testing new solutions, because most of them are not built to integrate new technologies in their processes. So it's very difficult at the moment to find areas to test digital health solutions in real conditions. So that's what we want to do with this project. And just to finish, here are some of the partners that we are working on this project. So we have several hospitals. We have health insurance companies. We have third places that already exist. We have big companies and public laboratories. And that's it for me, I think. Thank you for listening to me.